Okay, good afternoon and welcome to the Wayne County Health Catalyst Health Literacy Training. Before we get started, we're going to go ahead and ask you to fill out this pre-session evaluation if you're joining us online. I'll go ahead and pause it here and you can either scan the QR code to access or Brittany, I don't know if, Teresa, are you able to access with the QR code?
I can probably do it with my phone.
Okay.
Okay, I can post. I have the link from last time. I'll put that in the chat.
Okay, great. So we'll be back in just a few minutes.
Okay.
Okay, welcome back. We'll go ahead and get started. Teresa, this is going to be probably more like a conversation. Before we introduce ourselves, can you tell us a little bit more about yourself? What is your role and what do you do at CHAZ?
I'm a CHW community health worker. Just recently graduated, got certified in August. And we pretty much, like right now at the moment, we're running a study for the University of Michigan for pre-diabetes. So we're kind of facilitating sessions to give them a little bit of material and information how to prevent diabetes.
Okay,
So
that's really
we do other things too as well. We do like health risk assessments with patients and to better understand and help them get what they need. So far.
Okay. Well, it sounds like you're doing some pretty typical CHW stuff, which is awesome, which is being right there as part of the care team and you know, advocating for that patient that you're with. My name's Carolyn Custer. I am the person who's in charge of the health literacy training. So this is the training that I developed in partnership with a bunch of other people. And we're actually all part of this grant that's actually a Wayne County grant. And CHAZ is one of the partners in it, providing the COVID-19 vaccine. So we're going to talk about COVID-19 vaccine a little bit today and health literacy a lot. Brittany, go ahead and introduce yourself. Oh, you're muted. Sorry, Brittany.
Okay. So my name is Brittany. I am a community health worker as well. And I actually graduated or certified the year before last. So I've been doing this for a little over a year. I work at Pop-Off Family Health Center. It's a clinic of Authority Health. And I also assist with the coordination of the community demonstration kitchen, where we promote food as medicine and healthy cooking demonstrations.
Thanks, Brittany. All right. So we'll go ahead and get started. We're going to talk a lot about health literacy. We'll review actually 4 health literacy interventions, take a quick break, and then we'll come back and talk specifically about strategies to overcome vaccine hesitancy. So again, we want your input. This can be an interactive session. The learning objectives, describing health literacy as a determinant of health, identifying some strategies to address health literacy. And we talk about culturally and linguistically appropriate services and culturally competent care. All right, and then understanding and identifying strategies for that vaccine hesitancy. Have you seen this image before, Teresa?
Nope.
Okay, so we're going to start with a brief review of health equity. Okay, so health literacy is one of the social determinants of health, and we'll talk about that in a few slides, but it all boils down to, are the systems providing equitable care, right? So this is just an example of the difference visually between equality and equity. So with equality, everyone's treated the same. With equity, everyone is treated fair and impartial to get the desired outcome. So that's kind of a funny way of saying the accommodations that you need to be able to get to this outcome is what equity is. And we talk about health equity, and that just means everyone has a fair and just opportunity to have the highest level of health they can, right? We talk about, we want people to be healthy. We want them to feel well. Well, are they receiving the care, and is it equitable, you know? So this slide takes it one step further, and this is kind of what we do with the work that we're doing, is justice. And so, you know, we have these systems that were set up. Well, what if we address the cause of the inequity in the first place, right? So maybe it's better transportation system to get to the doctor, or maybe it's, you know, whatever it is. But in this version, you can see the cause was removed, and now they all can have the, you know, the equitable opportunities. And this is another version of it. I love this book called The Giving Tree. Again, inequality, you know, they're not getting the same equality, but with a question mark, are they really getting the same? Because still this person has not the opportunity. Equity, we give accommodations, and then justice, we fix the problem from the first place so that it doesn't happen. Social determinants of health, you guys are CHWs, you guys understand that there's a lot of different things that go into health. It's not just coming to the doctor and seeing a doctor. And so, you know, healthcare system, health literacy kind of falls into here. And so, but it can be impacted by all of these things. So we're going to talk about that throughout this lecture. All right, Brittany, I'm handing it over.
All right. And also health disparities. CDC defines health disparities as preventable differences in the burden of disease, injury, violence, or opportunities to achieve optimal health that are experienced by socially disadvantaged populations. And they exist because of health inequities and factors like social determinants of health and systems designed with structural racism. And when we think about health literacy in Wayne County, we have to acknowledge that systems were built with structural racism. And I'm not sure if, Teresa, you've ever heard of redlining?
No.
Okay, so redlining has affected the quality of life because it determined who could live where within the city. And we see history of the healthcare in Detroit, access to healthcare and access to education. That is all affected by redlining.
And Teresa, the redlining was a policy put into place in 1939. So we're still dealing with it almost 100 years later.
An introduction to health literacy. What does health literacy mean?
What do you think, Teresa?
Health literacy, it's like the information you are providing for the patient or the person.
Yeah.
So,
okay, sorry.
Oh, I was going to say, you can go ahead and start if you want.
Okay. So Healthy People 2030. Did you want to go over that?
Okay, well, I'll do this. So Teresa, the definition, we're going to talk about healthy people real quick. Are you familiar with healthy people? It's a report. Okay. So every 10 years, the United States puts out a report, and it's like the goals or targets for, you know, the citizens over the next 10 years. So traditionally in 2010, 2020, personal health literacy was one of the goals. And I'll let Brittany describe personal health literacy and organizational, but before she does that, 2030 was the first time that they added in another component, which is the organizational health literacy. So go ahead, Brittany, and you can describe the two.
Okay. So personal health literacy is a degree to which individuals have the ability to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. Okay. And also organizational health literacy is the degree to which organizations equitably enable individuals to find, understand, and use information and services to inform health-related decisions and actions for themselves and others.
Right. So, in the past, it's always been the patient, like the patient needs to learn more. The patient needs to learn more. Now we need to present things in a way that the patient can understand.
Mm-hmm.
All right.
And here are the components of health literacy. So you have to have skill and knowledge needed to interpret the health information that you're receiving. So that includes literacy, reading, writing, basic math, speech, and comprehension skills. In addition, it includes numeracy, understanding how math is used in the health world and being able to apply it to make the best possible decisions. And factors that impact health literacy, it could be the complexity of health information. Maybe it is, above the person's reading level, language, age, state of health, maybe anxiety or illnesses, and cultural background. And the way health information is communicated by the health providers.
All right. So this slide just shows all the different pieces of health literacy in a public health context. Sorry, Brittany, if you want to go ahead and.
And individual factors that, let's start health literacy in the public health context, complexity and novelties, severity and salience, sorry.
Yeah.
Okay, so we're gonna go over the individual factors that impacts health literacy. It's literacy skills, health knowledge, demographics, culture, and experience. And the system and professional factors is public health practice, communication dissemination, public health infrastructure, access to services and resources, and public health workforce skill and knowledge experience.
So it's a lot of different things. It's a big, big picture. Impacts of limited health literacy. So if the patient doesn't have a higher level of health literacy, they may be less likely to use preventive health services, things like pap smears or mammograms. They may be less likely to effectively manage their chronic disease, right? So that's, you're doing the whole thing to teach them and give them, tips and tricks on how to manage that disease.
Mm-hmm.
More likely to have poor medication adherence. Of course, you would kind of need to understand how the medicine works and why it works to, make sure you take it as prescribed. Higher rates of hospital ER, higher mortality rates, unfortunately. Report a sense of shame about their health literacy. There are many people that may not want to admit that they can't read or that they don't know the information, because it is, the way we are in this country, we just push individualism, and it can all of these are associated with a higher healthcare cost, which you understand. On the community level, of course, if there's limited health literacy on the community level, there might be missed opportunities for all these wonderful fairs that we provide, preventive screenings, lack of preparation for emergencies, disaster planning, public health warnings about food safety. Those are just some of the things, on a community level. So we're briefly going to talk about literacy. In our country, the average reading level of adults is 8th to 9th grade. But the issue is that most health education materials that we're using is 10th grade or higher. And that includes in translated languages as well. So what they recommend is the best reading level, and best is in quote, but is the 5th to 6th grade level. And that's really to make sure that whoever's reading it can understand it. And here's some red flag behaviors of things that you might see in your patients if they do have health literacy. Things like potentially missing appointments, maybe not completing the forms all the way, non-compliance with medication, unable to give coherent sequential history, potentially if they don't understand, asking fewer questions. This is something that we talk about, but that patient that you're talking with and they're just nodding, right? They're just nodding. They're not asking any questions. And you say, do you have any questions? They say no. that could be a red flag that they don't have the understanding of what the information is, and then lack of follow through. So we're going to talk quickly about a universal precautions approach. Teresa, with HIV and bloodborne pathogens, you know, we have this universal precautions. I'm sure you guys have both heard about this. And what does that mean, right? That means that if we see blood somewhere, we don't know if the person had HIV, hepatitis, whatever. So we use protective gear, right? We use precautions. So the same thing is true with health literacy. You really can't tell someone's health literacy level just by looking at them. It doesn't matter what their education is, what their job is. They could have a lack of understanding about health. And so really using this approach that we'll talk about today assumes that everyone has a low health literacy level, and it forces us to communicate in an easier to understand way. And so this can help our patients make the healthcare system easier to navigate and support the patients. Okay, this slide shows all of the different factors that are involved in becoming a health literate organization. You have the benefit of working at CHAS, which has a ton of wonderful resources, right? So you talk about things like this, I'm sure, at some level, whenever you're doing programming. But really, you know, it starts at the top. Does the CEO prioritize health literacy, or is the information, you know, flowing down all the way through to the people like you that are working with the patients? How is the materials to read? You know, are people learning about this at orientation? So there's a lot of things that go into this. So this is the end of the introduction to health literacy. Do you have any time that you can think of maybe a friend or family or even yourself had a lower health literacy and it maybe impacted their ability to be healthy?
Yeah, like if I have an example of in my home, my mother-in-law, you know, you take her to the doctor and she doesn't, she's like one of those like, oh, yes, yes, and forget to ask questions, you know.
Yeah.
So,
Yeah. So that makes a difference, right?
yeah.
But I feel like there's a generational thing too, where the older people, I don't know, maybe younger too, but they just think doctor knows best, so they're not going to question it, right? But they don't understand they can advocate, they can ask questions. So that's
Yeah.
your role, right? As the CHW.
Yes. Yes.
All right, we're going to keep going. All right, Brittany, you can take it away.
Okay, so health literacy interventions. Now, we will now review evidence-based interventions and strategies you can use to increase personal and organizational health literacy levels. These can be used to create a health literate environment. Health literacy strategy 1, clear communication. We always want to greet clients warmly, make good eye contact if it's appropriate, listen carefully, use plain non-medical language, be specific and concrete. I'm just reading them randomly, I'm sorry.
That's okay.
And okay, use the client words, slow down, limit and repeat content, and show graphics, demonstrate how it's done, invite client participation, and encourage questions.
Right, so these are all different pieces of communication that are important. Oh, excuse my husband. Go ahead, Brittany.
Okay, and 7 things to consider when communicating about health. Trust. You want people to trust the information. And who is the best, will people trust the information, and who is the best source to put the information out? And the information, what information is necessary, and how will people find it? How much is enough or too much? Motivation. How relevant is the information to the people we're trying to reach? And the environment. What are the conditions that surround and affect the audience? What is people's ability to act on the information, and are there any barriers? Perception. What will the audience think about the information, and what would inspire them to act on it? And response. How will people respond, and what what can we do to stay engaged with them and give them support as they take action?
Thanks, Brittany. And these are all good questions. Anytime you're putting a program together and you're thinking about communicating, just asking yourself, is this too much? Oh, I apologize. So using plain language, we tend to use medical jargon as doctors, but we really shouldn't. We should use words that are plain. One of the things on this list that we always bring up is the word diet. If you ask a patient, what is your diet? They're going to think, Weight Watchers or, some sort of diet plan, versus what you really want to know is, what do you eat every day, right? So just making sure that you try to avoid things that are medical and try to keep it plain. And this, I'll probably say 8 times today. Okay, your COVID test is positive. So this was actually at one of our health fairs during the pandemic. We had someone test positive, and they thought that was a good thing, because positivity is a good thing. So they didn't understand that positive meant they had COVID. So this is just an example of, it happens all the time. The words can be tricky to everyone. So instead of writing your COVID test is negative or positive, we were writing you have COVID or you do not have COVID. And that worked, right? So we adjusted. Okay, so clear communication is the first strategy. The second one is effective health education materials. Is this me or you, Brittany? I feel like it's me.
Okay. Effective health education materials.
You want to go ahead and do this slide, and then I'll do the next.
Okay. Health literacy strategy 2. Effective health education materials. Tips for effective health education materials. Materials are easy to read and understand. You want to check the readability, aim for 5th to 6th grade. Purpose of material is clear. If we're giving out handouts, we want to make sure it's clear, no irrelevant information, common everyday language. We want to avoid medical terms. And material is broken up into chunks that make it easier to understand. And material identifies at least one action item. And visual aids are used effectively. And we want to beware of confusing numbers.
Okay, so keeping all of these things in mind, what we're going to do is take a look at some materials. So Teresa, we're going to look at some COVID flyers first. Well, they're all COVID flyers, but we're going to look at these 3 first. Are you able to see these pictures? Okay.
Yes.
Okay, great. So this was 3 flyers that were put out. This one's MDHHS, Michigan. This one's CDC. This one's Authority Health. And they were all about vaccinating children for the school year. So if you look at these 3, thinking about the message, the colors, the words, which one would for you work or be the most effective? Keep the school year fun going, keep your cubs safe. COVID-19 is the best way, I guess, get ready for school.
It's in between the keep your cubs safe and because it's like to the point and give you information. The other one, the first one, don't give you much information.
Right. You have to go to a website, right?
Mm-hmm.
What about all these words? I mean, they're small, right? They're hard to read.
And not a lot of people are going to sit there and read the whole thing.
Right, right. So they have different, like this is bright, right? It attracts you. The colors are nice. The pictures are nice. There isn't really a clear message. I mean, a follow-up information, which this one does have. Call this number, you schedule it. All right, let's take a look at the next one. Okay, so this one was released when the vaccine was released, and they were trying to, a lot of people questioned how fast the vaccine was released, remember? So they put this out. And so my question is, how would this work with your population? This Scientists have taken hundreds of steps, decades of research, clinical development. You know, scientists and doctors in this picture, would this make your clients more convinced, or do you think this would work? Right.
I don't think so.
I don't think anyone thought so. We all thought this was a bad one. Not that it's bad, right? It might work for the right audience, but for the population that we're serving, it's not the right one. Okay, so the next three are kind of on one slide. This was when the Omicron came out, and I shared these three to show you that these two, you know, if you have multiple small print asterisks, so you have like here and here, and then you have all this small print down here, it's going to be confusing to people.
Yep. I
So
think
that
mostly people would see this white area here and
right,
not look at the small.
right. So that's one thing. And then if you look at this one, which by the way, still causes some confusion. We have both two asterisks is on day 6 through 10. I had people calling me left and right saying, you know, oh, my child's or my daughter's still sick, having symptoms day 6, but her job said it's been 5 days, she needs to come back. You know,
Wow.
you know, there's just a lot of confusion around when to come back to work. Do I have to wear a mask? Do I have to do a rapid test or not? You know, and again, we have all these small prints. And then the third one, you know, make a COVID-19 plan. This is right in the beginning. So what do you think about like the big statements versus the small print in this one? So like make a
Yeah,
plan.
I think that's to get to the point or like that's a plan, which the big writing is making a plan. And I guess if the bottom part, smaller writing is more detailed information
Which may be helpful for some people,
for some people. Yeah.
right? But maybe if just having these images and this big thing in each box, right? I mean, could have been more to the point. People look at this and they don't want to read it because of all that small print.
Yeah.
All right, I'll turn it over to Brittany for the next 2 or 3.
All right. So now this, what do you think of this graphic? The graphics, the pictures here, along with the messaging. Let me see. There's you know, some people can see the child crying, and you know, it might look a little scary.
A lot of reading.
And it's a lot of words there.
Yeah. So let's look at the next one.
Now this one doesn't have any pictures, but it has
There's a lot of reading.
a lot of words and
literacy. Yeah.
Yes, it involves a lot of reading. If you compare the two,
I think the first would
the
look
first
better.
one is the best one.
But it's got
There's still a lot of reading, but
Yes.
there's like pictures because people do tend to be more visual or get attracted to the visual.
Okay. What about this one?
What do you think about this message?
I think it's straight to the point.
Straight to the point. Yeah. Call the number or go to the website.
Yeah. Has a QR code.
So this, Teresa, this grant that we're currently working on through the Wayne Health Catalyst, this is our current messaging. We are putting out a campaign. I'll show you the other versions, languages after. I don't know if we have it yet. No. But this is what we're using for our campaign for this grant. All right, so some additional tips. Brittany, are you?
All right, so using health materials, just some additional tips. Don't assume your patient can read materials. And when viewing a handout, you want to circle or highlight the most important point or points, and personalize material by adding the patient's name, medication, etc. And we want to use teachback to confirm understanding and emphasize the importance of keeping the material so you can refer to it when doing follow-up with the patient.
And we'll talk in, last point.
And make sure patient has internet access when recommending digital material.
Teresa, is internet access an issue for the clients that you serve or not so much?
Some,
Some.
yeah, some of it, yeah.
Okay. Oh, and make sure to get their feedback on materials. Sorry for that one. All right, so clear communication, making sure you're using effective materials. And then our third one, which is teach back. Have you learned about teach back, Teresa?
Yes.
A little bit, yeah.
Mhm.
Okay. So, studies have shown 40 to 80% of the information is forgotten and nearly half of what's remembered is incorrect. So teach back can actually help increase comprehension. If you use it and you know about it, then you know that. But basically, right, we don't want to just talk to patients using a lot of medical jargon, etc. We want to make sure that we're explaining things clearly. And teach back is one way to do that. So it's a way of understanding by asking them to explain in their own words, right?
Mm-hmm. Yep.
Oh, okay. I'm sorry. It's not a quiz of the patient, right? We don't want them to feel uncomfortable. Like, I don't understand. We have to make sure that they know it's our job to make sure that we're explaining clearly. And it has been shown to improve patient understanding and adherence, decrease callbacks, and improve patient satisfaction. So just like clear communication, it's important when you're teaching your patients to use the caring tone of voice, attitude, empathy, right? Displaying comfortable body language, using that plain language, and using print materials to help, something simple they can look at and take home. Using non-shaming open-ended questions, avoiding questions that's just yes or no, right? Do you understand? That's the worst question you can ask.
Yeah.
Again, and then document the use of it if you do use it. So this is, again, a visual. It's important to chunk information. So rather than going over asthma, diabetes, hypertension, we're just going to talk about diabetes right now, and we're going to focus on that. And then you ask them to teach back. And if they're not able to, you just kind of have to change how you're teaching it and try again. So we're going to do an example of teach back. Brittany and I, we have 2 role plays that we're going to do throughout this, and this is the first one. But we're going to start, you're going to think this is ridiculous, but we're going to start with an example that doesn't use teach back. So there's no handouts involved. I am the provider and Brittany's the patient. And here we go. Ms. Reed, you have COVID. I'm prescribing Paxlovid, the antiviral medication authorized by the FDA to prevent severe COVID symptoms in people at higher risk. Paxlovid has 2 antiviral medications in it, 300 milligrams of nirmatrelvir and 100 milligrams of ritonavir. They exert antiviral efficacy by inhibiting a necessary protease in the viral replication procedure. You'll need to take each dose twice daily for 5 days. You also need to use barrier protection when you're having intercourse for the remainder of your oral contraceptive pack. Serious side effects include allergic reaction, where you may have angioedema of your mouth and tongue, skin hives, rash, bleeding, blistering or peeling skin, or trouble swallowing or breathing. Also liver damage, so look out for hepatomegaly, jaundice, and pruritus. Any questions? Okay, I'll see you back here in 2 weeks. I hope you feel better soon. She didn't have a chance to respond. Okay, so did Brittany understand any of that?
It doesn't look like she did.
I don't even know. I understood, but I had a hard time even saying some of it. So not a good teach back.
No.
All right, so the next 3 slides are going to represent a handout, and we're going to do a new version. And this should hopefully be a little bit better. Okay, So Ms. Reed, as you know, your COPD and diabetes put you at higher risk for developing severe COVID-19. I'm going to prescribe you the antiviral medication called Paxlovid. This is what Paxlovid looks like. There's 2 pink pills and 1 white pill in each packet. You have to take all 3 2 times a day for 5 days total.
Okay.
Here's some additional information about taking Paxlovid. I've highlighted the most important instructions, such as swallowing the tablets full. And here's a list of medications you cannot take with Paxlovid. Also, it can cause your birth control pill not to work right. So if you do have sex for the rest of this pack, you need to make sure you use a condom or another barrier protection. And here's some side effects to look out for. The most important is liver problems. Please call us if you notice your skin is getting really itchy or your eyes or skin turn yellow. I'd like to make sure I explained everything clearly to you. So can you please tell me how you're going to take Paxlovid and what you're going to look out for?
Okay. So each pill has 3 pills. Each pill packet has 3 pills, right? And I need to take 1 packet 2 times a day for 5 days and avoid all of these other medications here.
Right.
And also, I can't remember what side effects to look out for.
Remember, liver damage is the big thing.
Oh, yeah, that's right. And I'll call if I notice my skin or eyes turning yellow, my skin gets really itchy, and my urine gets dark, right?
Yep, that's right.
Okay, we'll do.
Okay, we'll see you back in a few weeks.
All right.
Okay, so Teresa, any questions?
Nope.
Okay.
Okay.
We're
No
actually
questions.
going for timed purposes. It's almost 2. We're going to skip over 4, and that's okay. So we'll go right on to health literacy 5, which is actually going to be 4 moving forward. Okay, so we're going to talk about cultural competence and language. Teresa, we're going to talk about some translation do's and don'ts as part of this. Are you bilingual?
Yes.
Okay. So we're going to say things that you probably are going to, potentially agree or disagree, but we'll talk about it. That's all. So I'll let Brittany go ahead and get started.
Okay, so health literacy strategy 5, you want to consider language and culture. Now, Wayne County has a mix of populations with different languages and cultural beliefs. Now let's begin with a review of class standards, culturally and linguistically appropriate services, framework to deliver healthcare services, respectful and responsive to patients' cultural health beliefs, preferences, and communication needs. We want to promote health equity and reduce disparities. Class themes are principal standard, governance, leadership and workforce, communication and language, engagement, continuous improvement, and accountability. And strategies to implement class. This is language related. We want to assess language preferences and language assistance needs and use acceptable language assistance services. Do not use unacceptable. And plan for interpreter services in advance and provide written materials in patients' preferred languages. Culture related. Respectfully ask patients about their health beliefs and customs. Avoid stereotyping based on religious or cultural background. Acknowledge and address implicit bias.
Okay, so yeah, these are the strategies, which the population that you serve at Chaz, is it primarily Spanish speaking?
Hispanic, yeah.
Yeah.
Mhm.
Okay. Go ahead, Brittany.
And language translation services, do's and don'ts. You do want to use bilingual clinicians or staff members whose proficiencies has been confirmed, staff who are trained as interpreters, on-site trained medical interpreters, telephone or video medical interpreter services. And we don't want to use clinicians or staff who are not trained and or certified as medical interpreters. And the patient's family and friends, this poses a problem with patient privacy. If the client insists, we want to respect their choice and have qualified interpreters present. And minors should never be used.
All right. So you're nodding your head, so you agree.
Yeah.
You know, we know in real life, sometimes minors are with the family, right? Does that happen at well, you have a lot of qualified staff that are bilingual, so
Yeah.
you might not have that issue. I don't know if you're familiar with Care Guides from Michigan, Teresa. We're going to send the slide out after the link here, but they have materials on almost every topic you can think of. I mean, it's not just these diseases. There's a whole bunch more, and they have them in all sorts of different languages. They worked really hard to make sure that all of the materials on this site are 5th to 6th grade. So you might want to take a look at that. You know, this is from MDHHS. They did have COVID vaccine in different languages. And then this is the most recent. So this is what we're using for our campaign. So you can see that it's translated Spanish, Arabic, and
Arabic,
yeah. Bengali? I'm not, you know what? I need to check and make sure I know what language that is. I apologize. Okay, let's talk about cultural competency. So this is a big thing. You know, medicine has evolved so much, right? And we just for a while thought, you know, we just treat everything was the standard was white, right? White people were the standard for all the research, everything. And we didn't really consider culture and the importance that it plays in health, in the family unit, and in making decisions about healthcare. So this is important, right? We know that religion, culture, beliefs, ethnic customs can influence how people understand health and how use information and make decisions. So cultural competence relies on the principles that we've been discussing: trust, respect for diversity, equity, fairness, social justice. And it's really a set of attitudes, behaviors, and policies that allow people to work effectively in cross-cultural situations. So let's talk a little bit about this. How can culture impact health engagement? You may be aware of some of these health beliefs in some cultures. If you talk about an outcome, it could happen. So you want to avoid talking about it. Health customs, you know, in some cultures, family members may play a large role in healthcare decision-making. Roles in men and women, right, in society make a determination of who decides medical or health treatments. Religious beliefs, some, you know, religious faiths or spiritual beliefs may impact how a person uses health care treatment. Dietary customs, you know, we always want to tell everyone use the DASH diet for heart problems, but you know, a lot of times we're recommending foods that maybe the patient doesn't know how to cook with because they have a different dietary custom. So making sure that we're recommending foods that fit within that population's customs. And then interpersonal customs, depending on who you're working with, eye contact may or may not be appropriate, as well as physical touch. So it's really important that we get to know our cultures, our populations that are served, the language, etc. Implicit bias is something that we talk a lot about now in healthcare. As you know, we all have unconscious and sometimes conscious bias. You know, we're all raised differently, and we all develop worldview based on how we're raised and how our family beliefs are and where we're born, and all of that stuff, it, you know, goes into it. So part of cultural competency is really understanding that your own beliefs and values and customs are great, but someone might have other beliefs or customs, and that's great too. And it's important to remember that your life experience is only a point of reference, like to learn from others. We really have to get out of my way is the best way to live. You know, you're not living like me, then you're not good. Because there's a lot of different really good ways to live.
Mm-hmm.
So it's our job to reflect and make sure that our biases, if we have any, aren't impacting our level of empathy or the way that we communicate. And I don't know if you've taken the implicit bias test from Harvard, but it is a little bit interesting, and the link's available on the slide. So some strategies for patient-centered awareness. Of course, remember race, ethnicity, gender, etc., spirituality can play a role in the perception of healthcare. Understanding the community you serve, right? The different cultures that make up the community. Talking with people and having an open mind and gaining understanding of their beliefs and backgrounds. And develop cultural humility. Do not think your way is best. Of course, practice cultural etiquette. So really being respectful, being curious, and understanding other people's beliefs and values. And of course, study when you have time. So there's a link to the Office of Minority Health. I'm sure through CHAS, you have plenty of resources to do trainings and implicit bias and all this cultural competence. So empathy and open-mindedness are essential. Teresa, have you ever heard of The Body Keeps the Score?
No.
Okay. So this is a great book, but it's a deep book. It talks a lot about how trauma impacts the body. So we're going to talk just very briefly about trauma-informed service. Have you heard of toxic stress? Okay. How about adverse childhood experiences, or ACEs?
Mm-hmm.
You know about ACEs. Okay. So, you know, toxic stress is, we have different stress levels. We have good stress, right? A kid's about to take an exam. They get a little nervous. That's good. That'll help them perform on the exam. You know, you have tolerable stress. Let's say a child's driving with their family and they see a terrible car accident and they see a dead body. That is a stressful thing, but with their parents providing that support, you know, the child gets through it and the stress reduces back to normal. Toxic stress is when the stress is so high that your fight or flight or your cortisol continues to be dumped into your body, and that can cause health outcomes. So we understand that toxic stress and those adverse experiences, you know, adverse childhood experiences, if a child is hearing domestic violence on a regular basis, you know, they don't feel safe, they don't have comfort, that can impact their health long term, and we know that. So that's, you know, something to think about with trauma-informed service. This is Maslow's hierarchy of needs. I don't know if they go through this or not with your certification. Are you familiar with this at all, Teresa?
Yeah.
Yeah. Okay. So I'm not going to spend a lot of time on it. It's just important to see where meet your patient where they're at. And if they don't have this, don't try to talk to them about this, right? All right. The pair of ACEs. So this is through Dr. Dees. And so these are adverse childhood experiences, but, you know, we have to think about, again, at the very beginning of the lecture, the systemic inequities, you know, the systems that have been built, and the adverse community environments that have been developed because of that. So in order to really make a difference here, we need to make a difference all the way around on the community level. And I also dug through the positive tree, so this is talking more about, I just wanted to throw this in there. What does community resilience look like? Like, why are we doing all of this? You know, this is where we need to get to. So we have populations that are safe, stable, you know, have access to opportunity, and equitable and trauma-informed systems, you know, fair lending practices, fair policing practices, you know, health promoting infrastructure. So just something to think about. And then the last part, and when we're going to take a quick break, this is the last slide. So creating a trauma-informed space can apply to cultural competency. People have trauma exposed all over the place. It's everywhere, right? That's what I'm trying to say. So it's important to remember these things. So some questions that I challenge. Have you considered the trauma that the person has experienced? Have you considered the culture, the language that this person has experienced? Are you creating a safe place for this person to share? Do you have any conscious, unconscious, or conscious bias to consider, or can you even be unbiased? You know, there are some doctors that are practicing that have conscious bias, and it's a terrible thing. How does your background history, right, your upbringing, impact your ability to serve? Are your actions making others uncomfortable? Are the words you're using respectful and culturally appropriate? And then finally, am I actively listening, or am I just talking or listening to talk, right? So these are all things that are very important when you're interacting. Any questions on the trauma or cultural part, or any comments or anything you want to share from your perspective working in a queue where you serve minority population?
No.
Okay, makes sense.
Yeah, it makes sense.
Okay. Before we go on break, Teresa, have you learned about motivational interviewing?
Yes.
Okay. So when we come back, we're going to talk about motivational interviewing specific to vaccine hesitancy. And then we'll wrap up with a few slides on some misinformation stuff.
Okay.
Okay. So I'm going to go ahead and pause it. If you'd like, you can go off camera and take. Okay. So now we're going to talk about vaccine hesitancy and some specific strategies. So vaccine hesitancy, as you know, is a delay in the acceptance or a refusal of vaccine despite it being available. And it is a top global health threat, unfortunately. So why are people hesitant to get vaccines? There's a lot of different reasons, right? One of them that we've talked about quite a bit is the healthcare and socioeconomic inequality and inequity, lack of effective public health messaging or confusing messaging. A history of unethical research involving ethnic minority groups. So, you know, the things that have happened in the past, people have lost trust or faith in the healthcare system, which rightly so. Social disadvantages, right? Like we talked about, access to high quality information, growing spread of misinformation, disinformation, conspiracy theories, and then barriers to access, which aren't so much here in the United States. Do you currently have the new booster at Chaz?
Yes.
Perfect. I know some people were saying there was a delay in getting the vaccine initially. So this is a guide that came out in 2021. And again, you'll get the slides if you want to look into these 12 strategies. We've reviewed several of them. So like I said, we'll talk about MI, and then we'll talk about combating misinformation very briefly. So motivational interviewing, awesome technique, right? An evidence-based intervention to help with motivation and goal setting and understanding patients' motivations, right? So it's a guiding style of communication designed to increase the patient motivation and likelihood that the behavior will change or be uptake. And it really is based on a respectful and curious way, just being curious about people, right? And so we talk a little bit about the spirit of MI, which if you understand MI, you'll know the traditional way of medicine, of course, was doctor knows best, right? Where the expert, the patient doesn't know anything, they need to be taught everything. But really, we know that that's not the right way to provide care. Why? Because we might know book-wise how to treat something all day long, but we don't understand the patient's body, the patient's circumstances, the things surrounding the lives of the patients that may be influencing health, right? So we really need to look at it as a more of a collaborative journey together in healthcare. So ORS is the model that we're going to introduce. Of course, the O is for open-ended question. The key with motivational interviewing, asking those open-ended questions, right? And actively listening. So asking open-ended, not things like, do you understand? No, yes, no questions. Tell me more about this. How do you feel about this? Make this clear. Affirmations. So it's important to make your patient understand that you are listening and that you appreciate what they're telling you. So, you know, saying things like, it takes a lot of strength to go through what you've gone through. I can see you've really worked hard at this, you know, those types of things. Reflections, again, shows that you're listening. So just kind of saying back what they've said to make sure that you understand and that it's clear. So it's just, let me make sure I understand this, right? It sounds like you're saying, et cetera, et cetera. And then summarizing, you know, at the end, kind of saying, okay, this is what we've talked about. And then that'll give your patient a opportunity to say, oh, no, I didn't mean to say that. That's not what I meant by that. So they can clarify. And then it's a good bridge or place to, you know, transition between topics. So it's a technique. It takes a lot of practice. I'm sure you know that. I always encourage, usually we have a group on this call and I say, okay, all of the things we're talking about, you have to go learn more about because this is just a basic introduction. But yeah, it's a great technique and it works really well. Specifically to COVID, some of the things, now these are old, right? COVID's been around for a minute, but some of the things that are recommended, of course, are open-ended questions. Don't assume the person you're talking to has any vaccine acceptance, right? Acknowledge the patient concerns without judging. The last thing we need to do when we're talking to patient is judge them or judge the information they got, right? The information might have come from their parent. You know, you don't want to disrespect the person or place that they got the information. Instead, just provide factual information, high quality factual information. Again, showing awareness of your status as a messenger. Community health workers are great messengers. You're part of the care team. You know, you're the patient advocate. So who you are matters, and just understand and know that you have influence. And then linking the vaccine acceptance to the patient's hopes and goals. You know, in the beginning, like for elderly patients, a lot of them were saying, you know, I want to get vaccinated so I can hang out with my grandkids again. Remember at the pandemic, they couldn't even see, you had to like go to the door, and it was awful. So that was a motivating factor. So, oh, you want to, you know, you want to spend time with your family again. The vaccine will, you know, allow you to do that. So just linking it again. So we're going to do our second role play. I'm excited. And Teresa, this one, we're going to do a conversation between a doctor who's me and a parent who's Brittany. And the first time we go through, it'll be the traditional way. So I know best, you know, she doesn't know anything. And then the second way, we'll do it with the MI approach so we can see the difference. Okay. All right. So Ms. Reed, it's important to immunize your child. If not, you're putting him in danger. Do you know there's still cases of measles in the United States? This disease could be very dangerous. And what about meningitis? It can be fatal, you know. You should update your child's vaccinations. He's already late according to schedule. Let's do that now if you want. Oh, you're muted, Brittany.
I don't see the urgency. Autism is worse than measles. There are more problems than solutions with this vaccine. And it's just completely unbelievable to give so many vaccines at the same time.
Studies have demonstrated that there is no link between autism and measles vaccine. The vaccine's safe, I assure you. You should be aware of the information you're finding on the internet. Giving several vaccines at the same time is safe and not associated with more pain. Let's do that now.
You know, I've heard something else, and not only on the internet. I read a lot, and vaccinations is not mandatory. I can do what I want.
Yeah, you're right. It's not mandatory, but you're putting him and other children who can't get vaccines in danger. The risk of disease is much higher than the risk of the vaccines. If I'm taking the time to speak with you about this, obviously it's very important.
That's easy for you, quick, but what if he gets autism? I'm worried about the risk of the vaccines, but you don't seem to be worried about the health of my child.
Of course I am. And I'm worried about the fact that he could get diseases that we can prevent with a vaccine.
Okay, well, I think we don't understand each other, and we're on a different page. We should maybe talk about this another time.
Okay, so that was the non-motivational traditional approach, and you can see that she was like, no, I'm not doing this. All right, on my approach. Ms. Reed, what do you think about the advantages of vaccination?
Well, I know the vaccines protect children against several diseases that we don't see anymore. My child received all his first vaccines, but I am worried about the measles vaccine and that they could cause autism. For other vaccines, I have fewer doubts, but I'm still hesitating.
As you said, vaccines have reduced diseases in such an important way they have now much less frequent. That's why you vaccinated your child when he was a baby. If I understood you correctly, with the exception of the measles vaccine, the other vaccines seem safe to you?
Yes, I know it's a good thing to prevent those infections, but about measles, I'm just so conflicted. I've read a lot of books and articles, and lots of people are worried about the link between the measles vaccine and autism.
So, let me make sure I heard you right. You find it's important to protect your child against diseases when the vaccines are safe, but you're worried about what you've heard regarding autism and measles vaccine. I see you've done a lot of research on the subject. If you agree, I could give you some additional information about studies on autism and measles specifically.
Sure. I want to know exactly what happened.
In fact, you're right. One study had hypothesized a link between measles vaccine and autism, but the study was fake and the author lost his medical license. More than 500 additional studies around the world have shown there's no link between the vaccine and autism. The frequency of autism is the same in vaccinated children as in non-vaccinated children. What do you think?
Well, I'm glad it's not me and I'm not crazy to be worried about this, right?
No, of course not. You're totally right.
And thank you for taking the time to understand my concerns. I really appreciate that. And this is a bit clearer now that you've discussed this with me.
Okay. So that was the example of a motivational interviewing where, I just asked her, how do you feel about this, right? All right. So we are on our last topic, misinformation. Teresa, do you know the difference between misinformation and disinformation?
No. Disinformation, I'm not sure what that means.
So it's about intent, really. Misinformation is false, but the person sharing it doesn't really realize that they're sharing false information. Disinformation is false information that's purposefully spread to create confusion, etc. So let's talk about social media. Do you use social media at all, Teresa?
A little.
Yeah, right. Like probably one of these. The whole point of this slide is just looking at all the different places where people get their information. I mean, there's a lot of different variations. So we have to understand how things happen with miscommunication. And so really, again, like I said in the last section, providing factual, easy to understand information is the best way to combat it. Don't judge people, right? Don't argue about misinformation. Using credible sources to demonstrate facts. The thing that we deal with now, and I don't know if you've had to deal with it, is what happens when people don't think the credible sources are credible. So, we have mistrust now in the FDA, in the CDC, etc. And I don't have an answer for that. Trusted messengers, again. Oh, I'm totally going the wrong way. There's faith-based, there's community champions, there's neighborhood champions, there's sometimes even local celebrities, so using those messengers in your programming can be helpful. And so there is a quiz. Excuse me. And so right before we wrap up, we're going to do a quiz and just review some factual information and see what you know about this. This is kind of a pinky quiz, but So the first question is, what is the recommended COVID vaccine regimen for people aged 6 to 64? So right now, what are they recommending? And there's 5 options. So is it 2 doses that covers BA4? Do you know?
No, isn't it 2? I mean, the A.
So I'll read them through. So 2 doses with Omicron BA4, BA5, 1 dose with Omicron BA4, BA5, 2 doses of coverage for XBB 1.5 or 1 dose for that. So these are all the same basically. And then the Janssen. Nobody's using Janssen anymore, so we don't have to worry about Janssen. So the actual answer is the newest vaccine is covering XBB.1.5 subvariant. And so just real quickly, the first vaccine, remember, it was just covering the first strain. It was monovalent, meaning 1, and that was the Delta. And then we had the Omicron outbreak, and that booster, that first booster that was released, covered the BA4, BA5 variants. Now we have our new boosters were just released. These cover the XBB 1.5. Like I said, they also cover just so we all know, BA 2.86. I'm not even going to read those, but there are coverages for additional subvariants. This is Pfizer and this is Moderna. So Spikevax. And which one do you know which one you have in your clinic?
I think it's Moderna.
Okay.
No, I think we have both. I'm not sure.
Okay. So yeah, so these are the current vaccines. The next quiz question, in March of 2023, people 18 and older had what compared to unvaccinated? So the question is, did they have the same risk of death from COVID, or did they have a lower risk of death? And if so, what do you think, how much lower?
And most people. I think it's the same risk.
It was 5.3. Like I said, these are just questions. I should cut some of these out. But here's the from the beginning of the from 2022 to 2023 April, you can see unvaccinated at the top, vaccinated at the bottom, and then Omicron boosted at the green. And so the vaccine did help. It was effective, I should say. And even acquiring cases, the vaccine helped to reduce the number of cases that were acquired. And now the disease itself, the virus is mutating, and as it mutates, it's getting weaker, and it's maybe more contagious but weaker, and so people are eventually it's just going to probably bottom out, I hope. Okay, the last quiz question. This is silly. We just talked about this kind of. So the new Pfizer vaccine covers, well, everything except for these 2. So the original strain was Delta, and the second series was Omicron BA4 and BA5. So these are the 4 that are current. All right. So honestly, that's the last of the information about the vaccine specifically. Do you have any time that you want to share about, or Brittany, about maybe when myths or disinformation prevented someone from getting the vaccine, or have you heard anything about it when you were out talking to patients?
I've been hearing a lot of people say that they don't want to get vaccine because it's the government putting a chip in your body.
Absolutely. We've heard that too.
Like,
that, yeah. So what do you say?
Well, at that time I didn't know, because I was like, well, that was way at the beginning when I heard that. I'm like, oh, really? But I still got it because I understood that that's like, it's like all the vaccines that we've gotten, as we're a child, and it's going to help us with our health.
Yeah. And there was, the chip thing was real. It still is. People still talk about it.
Yeah.
Okay. Any other, Brittany, do you have anything to share? If not, that's okay.
No.
All right. So we talked about a lot of stuff today. Brittany's going to go ahead and do the summary, and then we'll break.
Okay, and okay, so in summary, these are the key takeaways. Low health literacy is associated with lower health knowledge, poor medication adherence, increased use of ERs for primary care, and increased mortality rates, all which impact quality of life. And all of these are impacts of low health literacy. And it's important to use universal precautions and assume all patients have a low health literacy level. And improving individual and community health literacy levels can also reduce vaccine hesitancy and increase COVID-19 vaccination rates. And a final review, recommended grade level for written materials is 5th to 6th grade, and health literacy strategies can be used to increase patients' understanding about their health condition, empowering them to take an active role in their health. Clear communication, teach back, and using linguistically and culturally appropriate materials, as well as motivational interviewing and combating misinformation.
All right, thank you, Brittany.
Mhm.
Teresa, I will email out the slides and additionally a little handout, one pager on the techniques and how to use them.
Mm-hmm.
We do have a post-session evaluation. I'm going to flip back to the screen in a second. Just so you know, there's additional training, this next slide, and also the resources that everything that was pulled from for this lecture. So I'll go ahead and leave it here. Any questions, comments before we finish?
No, not really.
Okay, if you want to do the post-session evaluation, we appreciate it. There is an opportunity to get a completion certificate from Wayne County Community College District. So if you scan there, if you'd like that, you'll see at the end of the survey where it says we need this information to get a certificate. They do register you as a continuing ed student. That's where I'm lecturing through. So they do ask you for things like your name and your birth date, etc. So those are just required to register as a student.
Okay.
All right, so I think that's it. We'll go ahead and stop our